now from CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning, I'm Jim DeFede, and welcome to Facing South Florida. Later in the show, we will take a closer look at how important the Florida primary will be in deciding who the Democratic nominee for president is going to end up being. But I want to start with the story that is at the forefront of people's minds, the coronavirus. What is abundantly clear is that the United States was not prepared for this outbreak, nor do we know how bad it is either in Florida or across the country. And the reason is, we did not and still do not have the test kits to determine who has the virus and who does not. I spoke to Senator Marco Rubio about this earlier this week, about how we really don't know how many cases are out there right now.
You're right about that. I mean, and one of the things I said a couple days ago is the more we test, the more cases we're going to find, and it's going to look like it's spreading or there's a huge surge, but in fact what we are doing is identifying the problem. So, but there's no doubt there's more cases. You can only find the ones you test, and so that said, the one thing I really am focused on is ensuring that the resources that are available, whether it's tests or treatment, are focused on the places that have the highest risk of a terrible outcome, like a fatality. And we know that's places like nursing homes and ALFs and retirement communities, because the overwhelming majority of the fatalities, the people that have died, have been people over the age of 70.
So we have a lot to talk about, including Congress passing more than $8 billion in emergency funding. And in fact, the president signed that into law today on Friday. Well, we're taping this on Friday, obviously. Joining me this morning to discuss this is Dr. Aileen Marty, an infectious disease expert at Florida International University, and Democratic Congresswoman Debbie Mucarsel-Powell. Before being elected, she was an associate dean at FIU's College of Medicine. I want to thank you both for coming in. And let's start with the point that Senator Rubio was making, which was that the concern is going to be that now that we're going to start testing in the days and weeks ahead, we're going to see a dramatic increase likely in the number of cases. That doesn't mean that there's necessarily an explosion of cases. It just means we're finding those that are out there. Dr. Marty, do you agree?
Yes, I wholeheartedly agree with Marco Rubio, and I'll point out that we have very good scientific evidence that reveals that we have more cases. May I describe
Sure.
it? Okay, so for example, in Seattle, we had 2 cases of community-acquired COVID-19 in individuals that were too far apart for one to have given it to the other, and they had nearly the identical virus, indicating that whoever gave it to patient A gave it to patient B without knowing who's in between. And since neither of them were travel or knew one another in any way, shape, or form, there has to be numbers of people in between. So the science tells us there are many more cases.
And would you also expect that Florida, being the international travel center that it is, since we have not been testing here in Florida, I think the last time I looked, there were maybe 70 or 80 cases that had actually been tested. Most have turned out to be negative, but that's a minute number compared to the number of people who probably should be tested and will be tested in the future. We likely have a strong outbreak already here in Florida. Would you agree with that?
It's very difficult to know for sure since we don't have hard evidence, and I like to stick to the empirical evidence that we have. So we do have individuals that we have not identified their contact. That indicates that we have at least one individual, probably more, that acquired it in the community, which in turn reflects exactly what you're saying.
Congresswoman, I want to just, I don't want to get into a blame game. I know you don't either in terms of the administration or not doing right, but it seems to be that this is a serious issue, the fact that we were not prepared to have enough test kits available. And let me just, before I get you to answer, I put that same question to Marco Rubio, and I want you to hear what he says, because he acknowledges the problem as well. Here's Senator Rubio on test kits.
I think it's a combination of a technical failure in the development of tests here domestically, combined with availability. I mean, the people who manufacture these tests are the same ones all over the world, and if there's a demand surging in Japan and South Korea and countries closer to China, then obviously the availability is going to be less elsewhere. But you know, that's a valid criticism, but we can always look back and say, why wasn't this done, and certainly take that into account. But right now I think we need to focus on what we can do moving forward, because that's really the most important immediate thing before us.
We messed up in terms of not being prepared for this.
And this is where experience and leadership really matter, right? We first learned about the coronavirus over 9 weeks ago. That's when we should have already been preparing if this outbreak were to come to the United States. 9 weeks ago, we didn't really know about the virus, but we should have been in constant communication with the CDC to ask them what resources they need, which is why in the House of Representatives, we had to move very quickly. And this week we passed a funding package of $8.3 billion to make sure that we give the funding to the CDC so that we can actually manufacture the tests that we need in this country. We don't have enough test kits, and that's concerning to me.
Well, and I'm not sure that Senator Rubio's point is accurate, because I think my understanding is each country develops their own test kits. So it's not as if there's one global maker of the test kits and suddenly South Korea and China bought all the kits so that we don't have them here. You know, Germany, Australia, other countries have all been developing their own tests, as we have here in the United States. Am I correct?
Not every country develops their own tests, but yes, the United States, Australia, Japan, Korea, they can develop their own tests. And Germany developed the first really excellent test that we have for RT-PCR.
So let's just stick with the idea of what exactly you should do if you are home and feeling ill. If you're not sure if you have the coronavirus, there could be a lot of fear. You know, people watch the news. Look, sometimes I start adapting. You know, if I watch a TV show, I start with feeling as if I've got some of the same symptoms the person I'm seeing on TV. So if I'm sitting at home and I don't feel well and I wonder if I've got the coronavirus, what am I supposed to do?
Well, the good news is there's a hotline now.
Yes, we actually, Dr. Marty and I have been in contact from the very beginning. My experience working at the medical school has helped me through this crisis, because the first thing I did was call Dr. Marty, because I know that she's one of the top infectious disease doctors in the country. So Dr. Marty was the one that brought to my attention the need for a hotline so that people that were presenting with symptoms could make a phone call before going to their doctor to make sure that they need to go to their doctor so that they're not infecting everybody else and we don't overwhelm our health system. I'm concerned about the lack of health clinics, the lack of doctors and nurses. We already have a shortage here in Florida of medical doctors and nurses. So that's one of my concerns. I sent a letter to the governor, and Governor DeSantis activated this hotline fairly quickly, so I'm grateful for him doing that.
I'm going to give out the number now, and we'll eventually put it, I'm sure, hopefully put it on the screen as well. It's 866-779-6121. That's the Florida Department of Health. It's open right now. It's just staffed Monday through Friday, 8 to midnight. You know, it should be 24 hours. It should be 7 days a week. But right now, it's Monday through Friday. You know, because what you don't want to have happen is you don't want to show up in the urgent care center. You don't want to show up in the emergency room where you're sitting with a lot of other people. One, it increases your chance of possibly getting sick yourself from somebody else. But if you, in fact, you are testing positive, am I right, Dr. Marty, that you could then be spreading it to all those people sitting around you in the waiting room, which is why either calling your personal doctor or calling the Florida Department of Health is the right first step.
Absolutely.
Okay. To go back to the aid package that Congress just approved, the $8.3 billion, give me a sense for what this will do. What is this injection of money? Is it in part to bring in more test kits, develop more test kits, work on a vaccine? What are the types of things we're looking at?
$100 million of that package is going to go directly into providing resources to develop more test kits. About $300 million of that funding will ensure that vaccines, therapeutics will be affordable to so many Americans that are right now uninsured or underinsured. So in the House of Representatives, the Democratic caucus was really pushing to make sure that people that aren't covered don't get punished right now that we have an outbreak. And that they're not able to get, you know, affordable vaccines or therapeutics as they develop. Now, I want to make sure that everyone also realizes that we're conducting clinical trials right now, and we won't have vaccines available for at least 12 to 18 months. This is an entire process. We've had several meetings. And
that's even fast. That's even considered very fast to develop a vaccine, 12 to 18 months.
Yes. So we had a meeting last week with different pharmaceutical companies that were really explaining the process, and we want to make sure that once we have the vaccines, they're actually vaccines that are going to work for this virus. And also just making sure that we have the resources to develop more testing kits. We had a meeting with Vice President Pence where he says that the end goal is that we have test kits available for anyone that wants to get tested. The reality is that we're not there yet. So that's why it's so important.
Probably a ways away.
And that's why it's so important to make the phone call. If you present with symptoms, you should make a phone call first to your healthcare provider.
Dr. Marty, the news here, as I said, we're taping this on Friday. The city of Miami just announced the formal cancellation of the Ultra Music Festival and also Calle Ocho. Calle Ocho can have upwards of 500,000 people in very close proximity. Do you think that that was a prudent move?
It was a very prudent move, particularly with Ultra, because so many people come from other countries to Ultra, to Miami, and many of the places that they come from are where there are uncontrolled outbreaks. There's a lot of community acquisition. So in a city like ours, it's not just that they might infect the young people that go to Ultra, it's that those young people from our community would then transmit that to their relatives who are older and at higher risk, number one. And number two, there are a lot of economic advantages to canceling it now, as opposed to canceling it after people come with all their equipment, set up their stages and so forth, because things have gotten
Well, that's the
worse.
logistics, but from a health standpoint, you're saying it was a good move to cancel Ultra and cancel Calle Ocho, at least for now.
Well, there's another aspect to it, and that is there is the health economic aspects. People forget about the reality of, if my loved one is sick, it impacts my work, not just theirs.
Well, let me pick up on that, because one of the things that we've done on this show over the last year is highlight the struggles for the workers at Miami International Airport and Fort Lauderdale Airport, particularly those folks who prepare the foods for the planes and for those who clean the planes. These are people who are not paid very well, often do not have health insurance or can't afford the health insurance the company pretends to offer, are not permitted sick days. These are the folks who are cleaning planes. You know, this is a dangerous situation. If anyone was going to step up now, either at the county level or elsewhere, we should be giving these people the benefits. This is the problem with not having low-wage workers being given proper health care.
Yeah, and when we have this type of epidemic come up, it's really going to be a test for an entire healthcare system. We brought the attention of all these workers, not just airline workers, not just ULIN workers that we've been talking about before, but there are so many workers in America, here in Florida and across the nation, that don't have the benefits, that don't get paid sick leave, and they can't afford to stay home, and they fear that they're going to lose their jobs. This is a moment when we need leadership from this administration, and the House Democrats have been talking to the Vice President about this, that they will be assured that workers, if they are infected with the virus, if they have to stay home because they are presenting with any symptoms, they're not going to lose pay.
I can almost guarantee you that there are ULIN workers right now at Miami International Airport who are not feeling well, who are on those planes, cleaning those planes because they have to be able to make ends meet. And they don't think staying home is an option for them.
Yes, and this is a virus that doesn't discriminate based on the zip code that you live in. We need to make sure that we take care of all Americans here living in the United States, and that we work on containment efforts.
Dr. Marty, last question to you, because I get this sometimes from people who, when I do a segment like this, they'll push back on me. Has fear outpaced reality?
That's a very challenging question, to be honest with you. But anxiety and fear is our enemy, actually, because of the fact that if you're anxious, you're going to take actions that are not necessarily in your best interest, and it's going to alter your physiology to make you more susceptible to infection.
But this is a real crisis.
It's a real crisis, but people need to breathe, take a minute, understand all the data that we have, understand that even the scientific community is learning new things about this virus every day. So yes, some of the information will change, and yes, as Marco Rubio said, we are going to see more cases as we do more testing, but it's not necessarily in any way a reflection of a sudden surge in cases, but in our getting better at doing the right thing.
All right, let's end it there. I'm going to once again give that hotline number for the Florida Department of Health, 866-779-6121. If you have questions, concerns about your own health, call that number. All right, up next, the Florida primary is coming up. What should we expect? We'll have that when we come back.